Hi, I'm Robert Clemons. I'm an internal medicine provider here at MCMH. I started out at Iowa State. I was pre-vet, and when I got to the point to go to vet school, one of the professors was a good friend of my family's, and he really encouraged me to go into human medicine, in part because he knew some of the things that I enjoyed in life, and he felt that that would probably be a better fit. So then I switched and went to the University of Iowa for medical school. I then did a family practice residency at Cedar Rapids and have practiced numerous places around the state. I did family practice in Boone, which has been my home now for 30-some years. Because of what was happening in medicine at the time, with hospitals buying up small practices and hospitals joining together, it was really a difficult time for me at least, to be in small rural Iowa medicine that way. So I started doing what we call locum tenens practices. In other words, I would fill in communities where there was a need for physicians or expertise in administration, and did that for much of my career. That has brought me in and out of Clarinda 3 different times. And I really retired from there about 9 months ago or so. But several people who I had worked with in Clarinda but are now at Montgomery County Memorial Hospital reached out to me and said, "Hey, we're really looking for somebody. Would you be interested in helping when there was a real need here?" So I came here for approximately 2 months, enjoyed my time here, and they've convinced me to spend more time here, at least a year. You know, they really become my patients. Whether I'm someplace for 2 months or 5 years or whatever, I really identify them as my patients, and I take care of them, and as I would if as a friend. And so hopefully that ownership shows as far as the quality of care. One of the things that I found with a lot of physicians and people who come in and then they're gone is they really don't invest themselves in the care, in the patients that they're caring for. And I think investing yourself in that patient is so important. I'm trained in family practice, so one of the things I expect to be able to do is to bring some skills here that maybe aren't done typically in an internal medicine practice, and at the same time I have the opportunity to rely on my internal medicine partners if I have questions, and I feel very comfortable going back and forth with other physicians and saying, "Hey, I've got this going on, what do you think?" and getting their expertise to weigh in on things if I have any questions. And I find that with good training and 40 years of experience, that doesn't happen a lot, but I'm certainly willing to go to people if I have concerns or questions about what we're dealing with. I have a farm. In fact, one of the difficult things about coming down here is we're not going to move the farm so I can work in Red Oak. So it means my wife is up taking care of the farm when I'm here. Unfortunately, my schedule here allows me to be back and forth to the farm, you know, on a weekly basis. My wife's a commercial hot air balloon pilot, and I'm her crew chief. She's been ballooning 40 years now, and so I enjoy helping her with that. I'm a student pilot, but I've never bothered to get my license because she needs somebody on the ground that can help her do things safely.